Governor, I want to start by talking about kind of where we've been and to be a little bit transparent about this, because for more than a year, I and many of my colleagues asked you on an almost daily basis, when would we take off masks? When would businesses be fully reopened? When would restaurants have full capacity? When would our kids go back to school? And around July 4th or a little before that, a whole lot of that kind of came to be. And since then, here in Michigan, we've seen a slow but steady climb in the number of cases of COVID. We have seen the largest hospitalization in one of our biggest hospitals here in the state since the pandemic started. Some of the highest new case numbers, as I point out. Lagging indicator of deaths starting to reflect outbreaks, schools being closed for a week or more because of staff shortages and illnesses, and some of those staff shortages are due to illnesses. So my question is, where are we now? Is it time for the state to once again impose some of the same regulations as when we last saw these kind of numbers? What does it look like now to follow the science?
Well, as you and I have had many conversations over the course of the last year and a half, we know we cannot predict human behavior. We cannot predict a virus. What we can do is acknowledge right now we have the tools to stay safe. The people that are showing up with COVID and filling up our hospital beds are unvaccinated. That's a choice that many people have made, unfortunately. And that's where our work really needs to be, focused on educating and ensuring people understand these vaccines work. They are free, they are easy to access. And now anyone 5 years old and up is eligible. Anyone who's 6 months out from their second shot is eligible for a booster. The vaccines are really such a crucial tool that, of course, we did not even have a year ago. We know masks work. That's why we've been strongly encouraging parents and school districts to have mask requirements in schools. We've seen a real overlay of where people are getting COVID to where there's higher unvaccinated rates. It is absolutely, that's what's driving the issue that we have. So statewide mandates don't make a lot of sense in this moment because it is a specific population of unvaccinated folks that we need to encourage to get vaccinated. The more people in hospital beds with COVID, the greater price we all pay. Because God forbid one of us who is vaccinated needs to go to the hospital because of some sort of an accident or a heart attack shoveling snow, for instance. We need to know those beds are there. We need to give our hospital workers some relief. They've been working so hard, and we're already having our stressed out workforce. So for the sake of everyone, our effort really has to be about getting these unvaccinated Michiganders vaccinated.